This is USMLE Step 300 most ultra high yield prognosis risk factors. So, this prognosis factor I have made with from my notes from high yield questions from NBME's free resource that is available on USMLE website and first aid. Okay, so first of all, first condition is acute MI. Acute MI is presented with shortness of breath, left sided chest pain, dyspnea, um, and fatigue, like fatigue on exercising. And so, what are the most common risk factors? First of all, old age. Second, diabetes. Then, third is smoking, hypertension, dyslipidemia, prior coronary artery disease, and then delayed reperfusion. So, acute MI prognosis, if patient has early presentation to the hospital, he presents within few minutes and he has ST elevation MI, that is a good prognosis. And if patients present later to the hospital, like after a couple of hours, then the prognosis is relatively poor and they can present with cardiogenic shock, low ejection fraction, delayed reperfusion, and all of these presentation has high mortality. Moving on, second condition is heart failure with reduced ejection fraction, commonly also called as HFrEF. HFrEF, most high yield risk factor causing HFrEF is prior myocardial infarction, coronary artery disease, hypertension, diabetes, valvular disease, and cardiomyopathy. Okay, so now prognosis for heart failure with reduced ejection fraction is low ejection fraction, New York Heart Association class 3 and 4, renal dysfunction, hyponatremia means low sodium, and then S3, and then recurrent admissions that indicate poor outcome. Third condition is aortic stenosis. Aortic stenosis most common risk factor is age related calcification, bicuspid valve, chronic kidney disease, and then radiation for any solid organ malignancy. High yield prognosis for aortic stenosis is symptoms first, so symptoms like angina, syncope, and then heart failure, these have markedly worsening prognosis. And if there is untreated symptomatic severe aortic stenosis, that has poor survival. Next, fourth condition is aortic regurgitation. Now, aortic regurgitation most commonly risk factor is bicuspid valve, aortic root disease, endocarditis, connective tissue disease. And then risk factors that are associated with aortic regurgitation, most of them present in midlife. Moving on, prognosis is symptoms versus uh, actual condition, like actual pathology. So symptoms with left ventricle dysfunction, dilation predict poor outcome. If patients are asymptomatic and they have normal left ventricle function, that has a better prognosis relatively. So remember, aortic regurgitation present in midlife, like in 40s and 50s. Okay, moving on, mitral stenosis. Mitral stenosis mostly is seen in Asian or European women, and the most common presentation would be in women in their reproductive age. So, risk factor is rheumatic heart disease, female sex, and recurrent rheumatic fever. And then, prognosis for mitral stenosis is pulmonary hypertension, atrial fibrillation, right ventricle failure, and severe symptoms worsening when patient have shortness of breath, SOB, shortness of breath, hoarseness in voice. All of these are signs of worsening of mitral stenosis. Sixth condition is mitral regurg. Mitral regurgitation risk factor is mitral valve prolapse, ischemic heart disease, and then endocarditis, and then rheumatic disease. Prognosis of mitral regurgitation is left ventricle dysfunction, pulmonary hypertension, atrial fibrillation, and severe symptoms that predict worsening of outcome. Seventh condition is atrial fibrillation, commonly also called as AFib. So risk factor for AFib is that patients usually present in their older age, they have hypertension, heart failure, valvular disease, obesity, sleep apnea, hyperthyroidism. And then prognosis of atrial fibrillation is it can cause stroke like crisis, right? And then major risk factor is associated with high CHA2DS score. CHA2DS scoring is always done when you are suspecting severity of heart condition. And then another prognostic factor of AFib is heart failure, structural heart disease, and worsening overall prognosis. Number 8 is ventricular tachycardia. Ventricular tachycardia risk factor is prior MI or ventricle wall scarring, cardiomyopathy, prolonged QT, and electrolyte abnormalities. Prognostic risk factor prognosis of ventricular tachycardia is sustained VTAC, sustained ventricular tachycardia, with structure disease, for example, wall perforation or rupture, and then this also carries high sudden death risk. So ventricular tachycardia is a very serious condition, and the prognosis can be sudden death because of untreated ventricular tachycardia or worsening VTAC despite treatment. Hypertrophic cardiomyopathy, number one risk factor is family history, and then another risk factor is sarcomere mutation. Then prognosis of hypertrophic cardiomyopathy is sudden death that can cause sudden death that can be caused by let's say patient had family history of cardiomyopathy, and now they are exercising high intensity training. Because of the demand and supply mismatch, patient may have sudden death. And then if patient also has unexplained syncope, that may indicate poor prognosis. Massive left ventricular hypertrophy, family history of sudden death, these are some of the prognostic factors that are associated with hypertrophic cardiomyopathy. Now, dilated cardiomyopathy, first of all, number one risk factor is alcohol consumption. So chronic alcoholics who have not been treated or who do not take any multivitamin, they have dilated cardiomyopathy. Second risk factor is myocarditis. Third risk factor is genetic disease. And then next is using doxorubicin and tachyarrhythmia. So doxorubicin and daunorubicin, these drugs cause tachyarrhythmia. Prognosis of dilated cardiomyopathy is low ejection fraction, ventricular arrhythmias, and advanced heart failure that worsens survival. And some of the toxic causes that are associated with doxorubicin, daunorubicin can be reversed with appropriate antidotes. Okay, next one is infective endocarditis. Risk factor of infective endocarditis is prosthetic valve, prior infective endocarditis, injection drug use, and structural wall disease. Structural wall disease. Prognosis of infective endocarditis is heart failure, staph aureus, large vegetation that may be present around the walls, emboli, and renal failure that predict worse outcome. Next is pericarditis. Pericarditis is um, commonly seen in people who have recent viral infection. Another risk factor is autoimmune disease, then tuberculosis, malignancy, uremia. Remember, tuberculosis is always in Asian population or people who went to Middle Eastern country or Russian country, Russia. Sorry, Russia. So those are the common geographic location associated with TB. And then malignancy. So malignancy can cause pericarditis, especially if there is some mediastinal mass like Hodgkin's lymphoma. Okay, and then prognosis of pericarditis is most commonly it is idiopathic and can be from viral causes as well. And so once underlying pathology resolves, uh, the pericarditis also resolves. And then tamponade, malignancy, and purulent, if patient has TB, can cause worsening prognosis. So the full file is in the uh, comment section. I think there's a box below, and you can go ahead and complete and read the full file. And I will see you in the next video.